Samplings. There are four main types: calcium oxalate, calcium phosphate, uric acid, and struvite stones. Your kidneys filter 180 liters of blood every single day, but sometimes that process goes dangerously wrong.
A kidney stone is a hard mineral deposit that forms inside your kidney when certain substances become too concentrated in your urine. Stones form when urine becomes too concentrated. Minerals crystallize out of solution, just like salt crystals forming in evaporating water.
8% of kidney stones are calcium oxalate formed when calcium and oxalate bind together in urine that isn't diluted enough.
Insort. Risk factors include dehydration, high oxalate diet, family history, obesity, and living in. Small stones can remain silent for months or years, growing slowly until they reach a size that causes problems. When a stone enters the ureter, intense waves of pain begin. The ureter contracts forcefully, trying to push the stone toward the bladder. Pain signals travel through spinal nerves, explaining why kidney stone pain radiates from the back and flank down to the groin. When a stone blocks the ureter, urine backs up into the kidney, causing it to swell, a dangerous condition called hydronephrosis. Intense ureteral pain activates the vagus nerve, triggering nausea and vomiting, a reflex response to the extreme pain signals.
As the stone scrapes through the ureter, it damages the lining and tears small blood vessels, causing blood to appear in the urine.
The ureter has three naturally narrow points where stones most frequently become lodged. A CT scan without contrast is the gold standard for diagnosing kidney stones. Stones smaller than 5 millimeters often pass naturally within a few weeks, and most people can manage these at home with hydration and pain medication.
Drinking 2 to 3 liters of water daily is the most powerful treatment and prevention. Increased urine flow helps push.
Alpha blocker medications relax the ureteral muscle, widening the passage and increasing the chance of spontaneous stone passage by up to 60%.
Shockwave lithotripsy uses focused sound waves to pulverize stones from outside the body, shattering them into fragments small enough to pass naturally.
Ureteroscopy uses a thin camera guided up through the urinary tract. A laser then vaporizes or breaks the stone into passable fragments. For large stones, percutaneous surgery creates a small tunnel directly into the kidney, allowing the stone to be broken up.
An obstructed kidney with infection is a life-threatening emergency. Bacteria trapped behind the stone can cause sepsis. With prolonged obstruction permanently damages kidney tissue. Nephrons die from pressure, replaced by scar tissue that can never filter blood again.
Eating calcium with high oxalate foods binds oxalate in the gut, preventing absorption and dramatically reducing stone-forming material reaching the kidneys.
Reducing salt and animal protein dramatically lowers stone risk. Salt increases calcium in urine, while excess protein.
Citrate is a natural stone inhibitor that coats crystals and prevents them from growing. Lemon juice is a natural source that
Without treating the underlying cause, 50% of patients have another stone within 5 years. Stone disease is. Go to the emergency room immediately if you have fever with stone pain, uncontrollable vomiting, or pain that can.
Understanding kidney stones helps you prevent them. Stay hydrated, watch your diet, and subscribe to LessonX3D for more life-changing medical education.